again. Let it out. Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and today I have Aubrey here, and she's just going to tell us a little bit about what brings her in, and then we'll go ahead and start with our assessment and treatment.
I clean houses part-time, and I'm a vet tech part-time, so I'm working a lot and using my arms and shoulders a lot, so I have a lot of tension in my shoulders and in my lower back, so yeah.
Cool. And anything a little tense today or not too bad? Aubrey's been coming in for some maintenance care over the last several months to try to stay ahead of these kind of things, knowing that she uses her body very physically every day. So nothing really too bad today?
Nothing today, no. I just had a massage here also. So.
Perfect. So she should be ready to rock and roll. Well, we'll start with just watching you move. I'm going to have you slide your sandals off real quick, and then you can go ahead and just stand right in front of me, and we'll take a look starting with your neck. I'm going to angle you this way just a little bit, so face me this, like this way, yep. And have your feet together all the way. Great. And we're just going to start with your neck. I want you to look up as high as you can with your neck, okay? You have any discomfort there?
Nope.
Now I want you to go opposite and touch your chin to your sternum. Look down. Any discomfort with that, Aubrey?
Nope.
Look straight ahead and turn your head to the right as far as you can and to the left as far as you can. Any of that uncomfortable?
Nope.
Not bad? Great. Now I'm going to have you go ahead and face away, and then with your feet together, let's go ahead and take your right hand, reach behind your head and touch your left shoulder. And do the opposite arm now. Both of those a little difficult?
Left one not so bad, the right one, yes.
Any pain with that or just hard?
Just tense.
Tense?
Especially on this side.
Okay, like more up here?
Yeah.
Okay, now let's go above the head, touch the top of the opposite shoulder. Good. Other way? Good. How about with that? Any pain?
No pain, just it's a little harder with this side.
Okay. I'm going to have you angle this way now, feet together. Okay. I want you to twist back and to the right with your whole upper body. And back and left. All the way. Ooh, that's a little harder, huh?
Yeah.
Is that painful or just tough?
This side was a little painful, I guess.
Kind of on the lower right?
Yep, right here.
Okay. Go ahead, and now I'm going to have you angle this way. And with your feet together, I want you to look down at your toes and try to touch your toes, okay? Good. Come back up. Any pain? Reach above your head with both hands, and I want you to look up at your hands and go ahead and arch backwards. Any discomfort there?
Maybe a little bit in my lower back.
Okay. Now this one, we're going to keep the feet together. You're going to hold your arms out in front and squat as low as you can, keeping the feet together and the heels down, okay? Back up. How about with that? Any pain? Not too bad? Okay. We're going to check a few more things out here. I want to have you sit on the end of the table, and we'll lower this. There you go. All right. I'm going to start by I'm going to palpate, do a motion palpation scan starting in the pelvis. We'll work all the way up, and I'm just going to challenge the joints, and we're going to see how springy they are and where they're not moving so well, and that'll help us kind of determine where we're going to adjust you today. So I'm going to start down here, and let me know if any of these are tender or stiffer than other regions. Anything there? Mm-hmm. Then over. Aubrey's also got a big day coming up here in a few weeks. You want to tell everybody what's going on?
I get married on September 30th.
So we got to make sure that she's feeling really good so she can have a great time that evening. Is that a little tender as I get up into here?
Not really.
So do you feel, when I'm down here, do you feel that spring?
Yep.
And then as I get up, you feel that starting to stiffen up?
Yep.
So that is definitely restricted in this part of your thoracic spine, but doing the work you do all throughout the day, you're out in front of you all the time and or overhead, and this thoracic spine can get pretty restricted. So I'm going to assess that further by having you bring your hands behind your head, and I want you to bring your elbows together, okay? And then I'm going to have you lean forward onto my forearm, and I'm just going to motion you out a little bit more. Not too bad going up.
Mm-mm.
How about right there?
Not really.
A little extension and right rotation restriction. The upper thoracics. Good. Relax. And just let your arms hang. And right through there.
Mm-hmm.
Check the rotation of the neck. So I'm noticing a C2 and C3 vertebra aren't quite rotating, extending, or laterally bending like they need to. So you got all the above here. All right. Check one more thing. You felt it more on the with the shoulder movements. Did you feel that more on the right side?
Yes.
Okay. So what I want you to do is bring this arm out and then just rest it here. And I want you to go ahead and try to rotate back as far as you can. And then,
just the arm.
yeah, yep. And now go down. Any pain with that? Not bad. Okay. I'm going to just try to passively take it over. No pain.
Mm-mm.
And then under. No pain there. She has a little bit of winging going on in there, which can be some weakness in the rhomboid muscles and the serratus anterior muscles. So you won't see that on this video, but we would definitely go through and give her some things to work on at home that are going to help strengthen that shoulder blade and get it to glue down more to the rib cage. Especially if she's doing workout in front of her all the time, it's really important that that shoulder blade isn't lifting up and creating all this tension in the upper trapezius group, and then can eventually be leading to some shoulder impingement. So we'll work on that another time. But today, definitely found some good restrictions that we're going to get adjusted, and then we'll send her home with some homework, and she should be ready to rock and roll here for the big day, hopefully in a couple weeks,
Yeah.
and go from there. So we'll start with the lower back. I'm going to have you lay on this side facing me, okay? All right. And then we're going to bend the knee up, just like that. We're going to straighten the leg. Perfect. And then we're going to bring this shoulder forward like that. All right. And slide up just a little more. Right there. All right. Cool. I'm going to hold you here, and I'm going to rotate you into me.
Okay.
And just try to take a deep breath in and out while we do that, okay? All right. 1, 2, 3. Breath in, breath out. There you go. Nice. And the other side. That moved really well. Props to Ashlyn for getting that all loosened up. I didn't have to do any muscle work today because our massage therapist Ashlyn did a great job and got everything loose. Slide forward a little bit. There we go. All right, same thing. Just relax here. Deep breath in and let it go. Nice, good. Now we'll go on your back and we'll take care of the thoracic spine, that middle and upper back. So I'm gonna have you grab my hand, pull up, and then we'll go right back down all the way. And now we're just gonna cross elbows like you're hugging yourself, okay? Same thing, when I tell you to take a deep breath, let it in, let it out, okay? Deep breath, let it go. And again, let it out. Okay, back up, grab my hand. Okay, and lay on your back one more time. And just let your head relax, okay, Aubrey? Right here. Wiggle your toes. Nice. Good. And right here. Wiggle your toes. Nice. Awesome. How'd that feel?
I felt good.
Good? All right, good. Go ahead and stand here. And we'll start with the neck. Face this way just a little bit more. Feet together. Look up and down with your head and neck. All the way up, all the way down. Left and right. Very good. Go ahead and turn and face me now. Feet together. And then same thing we did last time. You're going to turn and twist all the way to the right and left, okay? Let your arms just relax. Yep. Very good. And the other way. Okay, good. Now I'm going to have you face the computer, feet together, look down at your toes, try to touch your toes. Back up, Great. Reach above your head, look up at your hands, arch back as far back as you can. Good. How's that all feel?
It was good.
Yeah? Awesome. Well, thank you for watching, and thank you for letting us work on you today, and hope you have an awesome wedding, and we'll talk soon. Thanks.
Thank you.